A lot of times patients will come to us here at Tufts Medical Center and they'll say, well, I'm leaking urine, or I'm going to the bathroom a lot, or I feel like I can't make it to the bathroom in time. And all of those things are parts of different problems. At our clinic here at Tufts Medical Center in urogynecology, we see two main components of female urinary incontinence. And one is stress urinary incontinence. So what happens is when women cough, sneeze, laugh too hard, exercise, or any kind of pounding that can happen, they leak urine, and it's an involuntary leakage of urine. It means that they can't contract the pelvic muscles strong enough to sustain that. The other is a set of patients who have complaints consistent with overactive bladder or urge incontinence. It's a little different than just going to the bathroom a lot. That's urinary frequency. Overactive bladder is where the muscles inside the bladder go into spasm and send signals to the brain where your brain feels like, if I don't go now, I'm going to have an accident, and sometimes they will have an accident. The mid-urethral sling is the latest treatment tool that we have in our arsenal for stress urinary incontinence. We do an outpatient procedure through a small incision, and we go in and we basically place a small piece of material, almost like a hammock, around the urethra. And by placing this material in, we want the body to scar in around it. So all of this scarring happens as the natural course after a procedure. And it then provides that backboard, that support for the urethra at its mid-level. And so that way, when someone coughs and sneezes, all of a sudden you have a little better tissue there. The procedure itself takes no more than an hour. Patients go home the same day. And we can quote about an 85 to 95% cure rate with these patients. Overactive bladder is a little bit more involved, and because there's so many different ways that we can do it. And the very first thing that we do is we get a voiding diary from patients. And that literally is a diary that we want patients to keep for a couple of days, and they send it back to us, we review it, and then we come up with a plan for them. A lot of time, very simple conservative methods. Patients don't realize how much they drink or how little they drink. But we do have a couple of alternatives that are surgical in nature for overactive bladder. We do offer posterior tibial nerve stimulation, which is like an acupuncture that we do here in the office at Tufts Medical Center. You don't have to go somewhere else. We actually place the needle ourselves. It's a treatment that lasts about 3 months. About 75% of patients see great improvement in their symptoms. And then lastly, if everything we've tried doesn't work, we actually do offer something called sacral neuromodulation. And we essentially put a small device that looks like a pacemaker that stimulates the bladder nerves. And, we reserve that for patients who've tried everything else and they really, really aren't getting much improvement or benefit. There's no cookie-cutter approach to any patient. We've developed a division here at Tufts Medical Center where we not only target the patients, but we can afford them the time that they really need, not only during their initial visit, but the follow-up visits. All the treatment options are offered right here on our premises. I work closely, obviously, with my general gynecology colleagues, we are part of that department. But because of the type of work I do, I actually work very closely with the chief of colorectal surgery as well as the chief of urology, because a lot of our patients have a lot of problems that kind of cross over, and it's very easy for me to get my patients in to see them, and then we communicate about patient care. And it is nice for the patients just to have everything done in one place. I always tell my patients, cure is what you think it is. If patients have had issues with leakage where they can't even walk out the door, but now they're able to do their activities, play with their grandkids, go running, whatever it is, and they don't have to worry about it, that's a cure to most patients.